Hey Anna, could you explain what are the three parts of IVF treatment with NOW-Fertility?
Hi, Anna. So yes, we have a three parts. So the first one is an initial inquiry when the patient will complete the form and we will contact the patient back. The second part will be the initial consultation with the fertility care coordinator and the fertility nurse present. And of course, the doctor will be there as well. And the third part will be the actual treatment plan. Okay, Anna, so can you explain a little bit more what's going to happen when the patient will complete the first initial form and how the process looks like then?
Yeah, so the first step is that they usually get contacted by a fertility care coordinator who will reach out to them in the language that they have requested. And then we ask them to fill out a few, like the registration form, the telehealth consent form, and we try and figure out what are their needs, and if we have any center of excellence that would be able to treat them. Okay, Anna, could you explain a little bit more about what happens in the initial consultation with the doctor?
Yes, of course. So during the consultation, we're going through all the details. We will go through the registration form, medical history, and the screening test, of course, based on the treatment plan. So obviously, it depends what kind of treatment this patient is doing. Then we will obviously discuss the relevant details, and then we will assign the treatment plan.
Sounds great. Okay, Anna, so once we have the treatment plan in place, then what are the next steps?
Okay, so once we have the treatment plan in place, then the patient will be contacted by the nurse and we will book the nursing consultation to go through the treatment plan and, of course, treatment protocol. We will go through the medications and also how to administer the medication. So the patient obviously will get all the informations. We will discuss the side effects of the medication during the treatment and general lifestyle, healthy diet, and of course, exercise as well, because it's an important part of the treatment.
All right. All right. So what is the role of the nurse during the treatment?
So I think the most important part of the treatment is to make sure that the patient feels supported by the nurse and of course by the whole team. So during the treatment, we need to make sure each time when the patient is having a scan, we are contacting the patient with the next instructions. They are aware how to inject the medication and what to do next. Also, we will inform the patient when to book the next scan and obviously where to go and how the next scan looks like and what's going to happen in each stage of the treatment. So the patient obviously will be informed throughout the treatment about all relevant information by the nurse.
Great.